Angelica Spurb.
Welcome to episode 91 of Spurbs Herbs. Today we're going to be doing a single herb chán tui or Cicada Periostracum or Cicada Molting. So that is what we're going to be doing today. So let's get into it. Today we are going to be looking at another single Chinese herb, and I have herb in quotation marks because this isn't really an herb. Chán tui or Cicada Periostracum or Cicada Molting. If you're looking at this right now, some of you are looking at this, I spell molting M-O-L-T-I-N-G. Though several of my books, they kind of went back and forth. Some wrote M-O-L-T-I-N-G and some used the diphthong and spelled it M-O-U-L-T-I-N-G. Both of them are correct. I think molting is correct in America and with the O, and the O-U is pretty much correct in all other English areas. But there you go. Either one's correct. So it's cicada molting. So they molt their skin, basically. This substance is in the Chinese medical subcategory of herbs that cool and release the exterior. It has several interesting functions such as venting rashes, clearing the eyes, and stopping spasms. And as usual, we'll explore all the intricacies of this substance as well as an explanation of its category. And as always, we will look at something a little different. We are going to take a sneak peek at the 5 elements of acupuncture medical ethics. Please join us for this intriguing episode. If you're not familiar, I have been teaching for quite a while now on a wide variety of topics. If you like this podcast, if you don't, well, I hope you do, and want to explore more of my courses, they are available at www.integrativemedicinecouncil.org and include a ton of different topics, including my drug herb series, looking at drugs and how they interact with herbs and vice versa, several ethics and safety courses, Chinese medical research, several treatment of condition courses such as arthritis, neck and back pain, COVID, depression and anxiety, all kinds of others. Inflammatory bowel disease, all kinds of them. And one of my favorite courses, the Chinese Herbal First Aid Kit. And they're all at a reasonable cost, and you can get an additional 20% off with the code SH20OFF, O-F-F. That's SH for Spurbs Herbs, 20 off. So continuing on from our last episode, the California Acupuncture Board recently started requiring 4 hours of law and ethics continuing education every 2 years. The National Certification Commission for Acupuncture and Oriental Medicine, the NCCAOM, or national boards, quote unquote, requires 2 hours of ethics professional development activities every 4 years. In light of this, I thought I would look at a course I developed to satisfy these requirements. The 5 elements of acupuncture medical ethics. This course looks at several important definitions in law and ethics, dives into the history of medical ethics, both Western and Chinese, discusses the 5 elements of ethics, medical ethics, before looking at the NCCAOM Code of Ethics and real-world applications of medical ethics. Here I'd like to give an overview of the 5 elements of acupuncture medical ethics. These 5 elements or ethical concepts include autonomy, beneficence, non-maleficence, privacy, and virtues. Autonomy is the right of an individual to make their own decisions. This principle refers to an individual's ability to decide what treatments to undergo and which ones to avoid. Autonomy is the principle that allows a person of a particular religious faith or other reason to refuse a blood transfusion, a medication, or any medical interventions at all. For a very long time, and sometimes currently, a doctor made the best decision for his or her patients without necessarily telling them why or fully informing them of potential risks. This is called paternalism and is a violation of the ethical principle of autonomy. Informed consent is a cornerstone to a patient's autonomy. If a patient doesn't know, how can they make an informed decision? For a patient to consent, they must be capable of consenting. They must be competent or have capacity and understanding. Those are technical terms. Usually a court decides incapacity. One is thought to have capacity and competence until shown otherwise. Children under 18 are incapable of consenting unless they are married or emancipated, which varies state by state in the US and I'm sure country by country elsewhere. Informed consent can be oral or written, though written is much more provable. I would always recommend writing it. Even if you do it orally, when you do a chart note, you should chart that they consented and what they consented to, if you're going to do it orally. But always much better to do it written. In our profession, informed consent forms are usually determined by our malpractice insurers and cannot be altered without their consent, or malpractice coverage may be compromised. So that was all under autonomy. Let's talk about beneficence. While paternalism may violate autonomy, it actually, remember, paternalism is where a doctor does something without fully explaining the risks and what they're doing. So while paternalism may violate autonomy, it actually can demonstrate the principle of beneficence. Beneficence is the principle of doing good, demonstrating kindness, and showing compassion. Basically, it means helping others. Many medical controversies are based on a conflict between autonomy and beneficence. For example, a great example of this is parents generally have autonomy over their children, but when they refuse a procedure for their children, they can refuse a procedure for themselves, but when they approve it for their children, the state, out of beneficence, may come in and say, no, you have to give this treatment to the child because there's very little risk and they will die otherwise, that sort of thing. So they're showing beneficence towards the child and violating the parent's autonomy. So that is just one quick sort of conflict between autonomy and beneficence. Is beneficence culturally based? In other words, could one culture believe an act upholds the principle of beneficence and another believe the same act violates it? And the answer to that is, yeah, things do change, can change between different cultures. And a great example of this is in Chinese culture and maybe Japanese culture as well. If someone has the diagnosis of cancer, often the doctor will tell the family there's a diagnosis of cancer, but not the patient, because the thought is that if you tell the patient that they have cancer, then you're going to shock them and make the outcome a lot worse. So out of beneficence, you do not tell them. However, that is clearly a violation of that patient's autonomy from a Western point of view. And in Western or developed nations, often autonomy is the most important of the ethical principles, and beneficence is not as necessarily as important as autonomy, at least in this case. And so the beneficence for the patient is overruled by the autonomy that the patient needs to be informed. And so that is very culturally different in ethics. And so definitely some differences between cultures. What happens when we are not sure we are only going to do good? There may be some harm in doing something. In other words, medical risks. So beneficence can only go so far. There's always medical risks in procedures and interventions. And so while we may have all the best intentions and have beneficence towards our patient, ultimately they have to make an informed decision and apply their autonomy. The next ethical principle is non-maleficence. Non-maleficence is the ethical principle that states that caregivers should not cause harm in others. This is what the Hippocratic Oath says, primum non nocere, first do no harm. This is in contrast with the previous principle of beneficence. Beneficence says one should do good, but nothing about harm. Non-maleficence says that one should not do harm without regard to doing or not doing good. They are opposite sides of the same coin. Together, these principles say one should do good and not cause harm. So, and that needs to be stated. That's very important ethically. Our fourth of the five medical ethics is privacy, and is another fundamental right of patients. The American Medical Association made it the first topic their ethical force oversight body addressed. That's how important they consider this to be, the first topic. is crucial for building trust. If a patient does not believe what he or she is saying is private, they will not divulge adequate information to diagnose and treat. One of the key concepts here is something called informational self-determination. This is a person's ability to control the flow of his own personal information, and that's a right. So we don't violate privacy lightly. In our last episode, we talked about mandatory reporting, where we have to, by law, violate someone's privacy. So there are exceptions to this, but generally we do not violate privacy. And finally, there's virtues. Virtues are defined as a beneficial quality or moral excellence. They're the characteristics that differentiate between good people from bad people. In the context of the 5 phases, virtues are like the earth phase. When earth is in the center of the diagram, this is the heavenly stem formation of the 5 elements. And all the other phases stem from and return to the earth phase. I should talk about phases and elements. I usually do. So the Chinese word is wuxing, and originally that was 5 elements, but a better translation is 5 phases of that. I use 5 elements here because elements imply sort of a rock bedrock to go on, and that's what these ethical principles are. They're bedrocks, rather than phases, which are a little bit more mobile and they shift into each other, and they're a lot more fluid than an element is. So the real wuxing should be 5 phases, but often is 5 elements, and I think 5 elements is wrong, I think, in the context of Chinese medicine. But I think for our concept of these ethical principles, it's important to say five elements. So anyways, so that's the virtues, the heavenly stems. So often we see it, the 5 phases in a pentagram sort of configuration, but then there's the heavenly stem formation, which has the earth phase in the center and the other 4 phases at cardinal points, so north, south, east, and west, going in and coming out. So like at the top would be fire, and then as it leaves fire, it goes into earth and goes to the metal element. And then as it leaves metal, it goes back into earth and goes into the water element. So that's how the heavenly stems works. And that's what we're talking about here with these virtues. In other words, virtues are the touchstones, the basis of the other ethical principles. Virtues include ideals such as commitment, compassion, conscientiousness, cooperativeness, courage, discernment, fairness, fidelity, freedom, honesty, justice, trustworthiness, hopefulness, integrity, kindness, and respect. So that was a quick introduction to the 5 elements of acupuncture medical ethics. If you'd like to know more or just need your ethics continuing education, please check out the whole 3-hour course, as well as other ethics and safety courses at www.integrativemedicine.council.org, and they're all there, ready for you to look at. And with that, let's get into today's herb. Today we're talking about chán Cicadae. Can't do it right. Cicada Periostracum, and it's in the family Cicadae. There's an extra DI in there, so Cicadae. Standard species is Cryptotympana pustulata fabriceus. And in Chinese, that's Heijia. That specific species is Heijia. The medicinal part is the molting. In English, chán tui is translated as cicada molting or slough of cicada, which to me are synonyms. Other names here are chán ke, chán tu, chán yi, chong yi, zhi liao ke, and in Japanese, sentai, and in Korean, seonsei. Again, I don't speak Japanese or Korean, so I'm doing my best here for those two. Bensky et al., which is, we now have 3 textbooks when we look at individual herbs. So Bensky et al. Is one of those textbooks, major textbooks. And they say the dosage is 3 to 9 grams. Chen say 3 to 10 grams with a maximum of 30 grams. And Brandon Wiseman also say the dose is 3 to 10 grams. They don't have a maximum, though. 3 to 10 grams, 3 to 9 grams, pretty similar. Let's talk about the Cicadae family. The Cicadae family is one of two families of cicadas and contains almost all living cicada species. In other words, the other family is not really living. There are 3,200 species of cicada, or under Cicadae. There are several distinctive features of this family of insects: membranous wings, short bristle-like antennae, and a triangular formation of three ocelli, or ocelli, I had to look up how to spell this, or simple eyes on top of their head. So I had to look up what an ocelli was. Singular is ocellus, are simple photoreceptors, light detecting organs. They consist of a single lens and several sensory cells. Unlike compound eyes, ocelli do not form a complex image of the environment, but are used to detect movement. Most arthropods, or insects, possesses ocelli. Some species of arthropod do not possess compound eyes and only have ocelli. So there you go. So this Cicadae family have a triangular formation of three ocelli, or simple eyes, on the top of their heads. Cicadas can be annual or periodical, which describe their emergence pattern as adults. I believe this last year we had a conversion of two periodical cicadas happening in the U.S. Huge. More cicadas than have happened in, like, I think 40 or 50 years or something like that. Long time that they both happened at the same time. Males will make loud clicking sounds to attract mates by pulling a membrane on the abdomen called a timbal. Females will respond with a click produced by flicking their wings. So there you go. That's where they get their clicking noises and yeah, they both have clicking noises. Okay, going back to our substance, medicinal substance. This is materia medica, medical substance material. So the category, according to Bensky et al., is in the cool, acrid herbs that release the exterior subcategory under herbs that release the exterior category. Chen say it is in the wind heat releasing herbs subcategory under the exterior releasing herbs category. And Brown and Wiseman say it is a cool, acrid, exterior resolving medicinal under the exterior resolving medicinals category. Bensky says it's sweet, salty, and slightly cold, and enters the lung and liver channels, while neither Chen nor Brand or Wiseman include the salty property, and they actually say cold rather than slightly cold. So Chen and Brand and Wiseman both agree it is sweet and cold, and enter the lung and liver channel. So this is what I love it when our textbooks go in different directions. So our two textbooks, which include the original source, disagree on which is the first book to feature today's herb. Bensky et al. Say it was first mentioned in the Materia Medica of Medicinal Properties, the Yaoxing Ben Cao, written during the Tang Dynasty circa 600 CE, written by Zhen Chuan. Chen Chen say the original source for this herb is the Mingyi Zazhu, Miscellaneous Records of Famous Physicians, by Tao Hongjing in 500 CE. So almost 100 years difference there. So that's interesting. Just on the surface, you would say, okay, well, the earlier one might be the way to go, but it's not always easy sometimes with the dates of these things. And so generally it's interesting history. So there are two different things. When it gets into this sort of discrepancy, I'm not a Chinese medicinal historian. So, and my Chinese skills are not up to anywhere near that level of being able to discern between these two. So I kind of put it out there for others to decide. I will sometimes, if there's a discrepancy I think I can do some research on, I will do that, but not in this case. So let's talk about herbs that release the exterior. We have now discussed this category and subcategory of herbs several times during our adventures examining Chinese herbs, and we will repeat that information here. According to Bensky et al., exterior releasing herbs are those that release disorders lodged in the very superficial levels of the body. When external pathogenic factors, including wind heat, wind cold, wind dampness, and summer heat, invade the body, they first attack its superficial exterior aspects. Symptoms associated with the exterior then appear: chills, fever, headache, stiff neck, and general muscle aches. Sometimes sweating will appear, which resolves the condition, in which case no treatment is necessary. At other times, however, there will be an absence of sweating, or even though there is sweating, it is not accompanied by any change in the condition. At this juncture, herbs that release the exterior are used. Most exterior releasing herbs are diaphoretics, that is, they release or expel the external pathogenic influences through sweating. There's a saying in Chinese medicine: when the disease is in the skin, sweating will bring it out. When a disease progresses slightly further into the body, it is said to lodge in the muscle layer. The clinical presentation then includes fever, general body aches, and profuse sweating. At this stage, especially when the patient is sweated without any beneficial change in their condition, it is appropriate to use the subset of herbs that release the muscle layer. The most prominent member of this group is Cinnamomum ramulus, or guejir. That's cinnamon twig. Some of the herbs that release the exterior have additional functions: stopping coughs and wheezing, controlling pain or spasms, and preventing rashes such as measles. Chen also have an introduction to exterior releasing herbs. The term pathogenic factors describes normally benign environmental factors such as wind, cold, or heat that are combined to disrupt normal physiological functioning and express themselves in the form of wind cold and wind heat. With drastic or sudden changes in the weather, or with a decline in health or immunity, these factors commonly attack the exterior or superficial parts of the body, that is, the skin and muscle layers. Therefore, an exterior syndrome refers to a condition characterized by wind cold or wind heat attacking or invading the skin and muscle layers of the body, causing symptoms and signs such as aversion to cold, chills, fever, headache, muscle aches, and pain, the appropriate presence or absence of perspiration, and a superficial pulse. The herbs in this category stimulate immune response, alleviate pain, regulate body temperature, and induce perspiration. They're most often used to treat common colds, influenza, and complications of complex internal disorders. So that was the category, herbs that release the exterior. Here's the subcategory, cool acrid herbs that release the exterior. So Bensky et al. Continue to discuss the subcategory of cool acrid herbs that release the exterior. Cool acrid herbs are used in treating wind heat patterns with such symptoms as relatively severe fever with mild chills and sore throat. Some of these substances are also effective in preventing rashes or treating eye problems due to wind heat. Good quality. Bensky et al. Say good quality consists of the whole castings. The shell should be thin, clean, unfragmented, and free of sand. They also say, although considered a variant, Cicada flammata Jin Chan is regarded as the best quality product, preferably that from Guangdong or Fujian province. So we have another textbook that we use, Chinese Medicinal Identification and Illustrated Approach. This is great for identifying and quality, all that. So that's a great book for explaining good quality. So they say, that's Zhao and Chen, say Chan Tui are shaped like a hollow cicada, slightly oval shaped and curved, externally yellowish brown with a light and membranous texture, which is hollow and easily crushed, a faint odor and bland taste. Superior quality consists of intact, yellow and shiny medicinal material. Chan Tui has a flat, round, and full abdomen with a blunt point of a tail, a translucent and lustrous exterior, two sets of small wings on the sides of the back, and a cross-shaped fissure on the back surface of the thorax with the opening curved inward. So what are the Chinese medical actions of this herb? According to Bensky et al., chán tui disperses wind and clears heat for patterns of externally contracted wind heat, especially with loss of voice and swollen sore throat. It also vents rashes for early stage of measles with an incomplete expression of the rash, and it clears the eyes and removes superficial visual obstruction for wind heat eye problems such as red, painful, and swollen eyes or blurry vision. And finally, it stops spasms and extinguishes wind for childhood febrile diseases in which wind causes convulsions, spasms, delirium, or night terrors. Also used as an auxiliary substance in treating tetanus. Chen and Chen say it dispels wind heat, vents rashes, and relieves itching, brightens the eyes, and extinguishes liver wind and relieves spasms. Brandon Wiseman say it disperses wind heat, outthrusts papules and relieves itching, clears the liver and brightens the eyes, extinguishes wind and checks tetany, and has the additional action for night crying in children. Chinese medicinal identification and illustrated approach also has some Chinese medical actions, which are often similar to Brand and Wiseman because Brand was one of the editors, or was the editor on the Chinese medicinal identification and illustrated approach. So that book says it scatters wind and eliminates heat, benefits the throat, vents rashes, relieves eye screens, which are superficial visual obstruction, resolves tetany, which is severe spasm and convulsions. So that is according to Chinese medicinal identification and illustrated approach. Preparations. Spensky et al. Discusses one preparation for this herb, and that is cicada abdomen or chán du. This is the cicada molting with the head and legs removed. The Grand Materia Medica, or the Ben Sao Gong Mu, written in 1590, instructs, before using cicada, use boiling water to remove mud, legs, and wings, dry and use. And Shang Shi Chun elaborated. Removing the legs means removing the large two front legs. These are very hard and stiff, with the ability to open and break up. So they're better retained when treating superficial visual obstructions or the swelling of skin lesions. When inducing sweating, however, they should be removed, since this breaking open action is undesirable with sweating. While this manner of preparation is no longer common, there are those who believe that the head and legs are more cooling, while the body of the insect is better at relieving spasms. Regardless, it is important to clean the moltings well and use plenty of boiling water to eliminate unwanted residue within the shell itself. There you go. Western uses. It appears this herb is primarily a Chinese herb, and the PDR for herbal medicines likewise does not mention this herb. So there were no sources that I could find that explain this herb in Western, how Western herbalists would use this herb, because it just isn't used by Western herbalists. Chán tui commentary. So Bensky et al., as usual, has an excellent commentary on this herb. And here they are, quote, Cicadae Periostracum chán tui is sweet, salty, slightly cold, and light in weight so that it ascends. It dissipates and disperses wind heat in the lung channel, releases the exterior to disperse heat, vents rashes, stops itching, and treats hoarseness. It can also expel liver channel wind heat, cool the liver, extinguish wind, and treat children's night terrors, tetanus, superficial visual obstruction, and vertigo. Chán tui not only expels exterior wind, but also calms interior wind. It can therefore treat spasms and convulsions. Its ability to vent rashes is also considerable, but if the pathogenic heat has already penetrated deep into the nutritive and blood levels, it must be combined with strong blood cooling, toxin relieving herbs. Otherwise, the heat will be pushed out improperly, making the rash worse and injuring the qi and blood. Thoroughly revised Materia Medica, or Bensao Song Xin, written in 1751, describes the clinical actions of chán tui. Transformed from the excess qi of wood and earth, it absorbs wind and sips the dew, and therefore it is sweet, cold, and able to disperse wind heat. Its body is light and floating, thus it brings out pocks and rashes. Its nature is that of casting off, thus it can cast off a cast in the eye, promote labor, and the expulsion of the residue of the birth process. Its molting is like a peel or shell, thus it is good for skin sores and episodic rashes. Zhang Shichun observed, chán tui is slightly cool by nature with a bland taste, not really an acrid dispersing herb at all, exclamation point. The reason it can induce sweating is that as a skin itself, it can reach the skin. It is actually a marvelous substance in this context, especially appropriate for weak patients who cannot withstand normal exterior releasing methods. Chen Shirduo, in New Compilation of Materia Medica, or the Bensao Xin Bian, written in 1694, explored one important aspect of this substance in the treatment of eye disorders. Chán tui is an absolutely indispensable herb to protect the eyes in children's pocks and sores. The question then arises, does chán tui truly have this effect of protecting the eyes and ridding them of superficial visual obstruction? The answer is affirmative, but it must be used knowledgeably. The effect of chán tui protecting the eyes works only before the pox erupts. It will not protect eyes that are already surrounded by pox sores. Whenever pox sores appear in numbers on the head, it is essential that the eyes be protected. Among the exterior releasing herbs, first use chán tui, the idea being to definitely prevent both eyes from erupting with pox. But if the sores have already appeared in the eyes, it is too late. How can one rescue the situation and make them leave? Chen's point is that chán tui must be used in the very early stages of pox, threatening to cause superficial visual obstruction in the eyes. The substance is still effective, however, for other types of superficial visual obstruction. He concludes, for the average superficial visual obstruction, even small doses of chán tui are effective. For obstructions from pox, even large amounts will not work. Interesting. So that was Bensky's commentary. Chen have an author's comment on this herb as well. So according to the Bensao Gongmu Materia Medica by Li Shizhen in 1578, cicada treats all symptoms related to wind heat. The entire insect is more effective for the treatment of diseases of the internal organs, such as to calm liver and relieve muscle spasms. The molted casing is more appropriate to treat exterior disorders, such as dermatological disorders caused by wind heat. All right, and that's our commentary on this. Let's talk about some combinations of this herb. So Bensky and his team combined this herb with three others. The first one is Sterculiae, Linchnophorae, semen, or Pongdahai. This is an interesting one. Pongdahai was not an herb that I really learned when first doing my Chinese herbs, but I learned that it's a very important Chinese herb and I've used it quite a bit. It's a very helpful herb, but the Latin name for it kind of changed right as I was learning the herb. So I didn't get this herb down very well, the naming of this herb down very well. So So let's compare these two. No, there's a combination. So chán tui is sweet, cold, and excels as expelling wind heat. Sterculiae, Lichnophora, semen, or Pangda hai is also sweet and cold with a clearing, bland flavor that cools the lung and assists in the dissemination of lung qi in order to treat hoarseness and loss of voice. Together, they are mutually supportive and are such an excellent combination for soothing a sore throat and restoring the voice that they can be used alone for sudden hoarseness. Equal doses of each substance should be decocted, then sipped frequently. If the problem is chronic, then other herbs to benefit the qi and tonify the yin should be added. Our next, I'm going to say herb in quotation marks again, is Scorpio or Chuan Xie. This is scorpion. So it's not really an herb, it's more of an herbal substance, or a medical substance, excuse me. Chán tui not only disperses exterior wind heat, it also extinguishes interior wind. Scorpio Chuan Xie is acrid, sweet, and toxic and enters the liver channel. It is one of the stronger substances for stopping tremors and convulsions. When chán tui is guided into the interior by Scorpio Chuan Xie, its wind extinguishing action can reach directly to the pathogenic locus and support the actions of Scorpio Chuan Xie in stopping convulsions. The pair is commonly used for seizures, tetany, and childhood convulsions. Our third combination is with Uncaria ramulus cum uncis or Goteng. The Gram Materia Medica recommends this combination for continuous night crying in children under 4 months of age. Li Shizhen advises, take 49 shells, remove the front legs but leave the back legs, powder, and divide into 4 portions. Mix with Uncaria ramulus cum uncis Goteng tea and force feed. So that's children under 4 months of age. So that's interesting use of this formula, of this herb. So comparisons. Let's compare this with some herbs here. Bensky et al. Compares this herb with one other, Bombyx batricicatus or Baijiangsan. So that is silkworm excrement is what this is. Both substances eliminate wind and release spasms and are often combined in the treatment of headache, swollen throat, and convulsions due to patterns such as wind heat in the lung and liver channels. Bombyx batricicatus Baijiangsan, however, also has the ability to transform phlegm and disperse clumping, while chán tui vents rashes and reduces superficial visual obstructions. I will correct myself. This is not the excrement. This is silkworm itself, I believe. It's just straight silkworm, not the excrement of silkworm. All right. Contents. According to Bensky et al., the main constituent of chán tui is chitin. If you're not familiar with chitin, that is the exoskeleton. That is what pretty much makes up the exoskeleton of insects. So a very common substance. It's a proteinaceous substance, so it's made out of protein. It also includes xanthopterin and erythropterin. So isoxanthopterin and erythropterin. There's a silent P there. I think it's silent, but if it's not, it's a thropterin. I'm pretty sure it's silent. Erythropterin as pigments and several amino acids and proteins, as well as organic acids and phenolic compounds. And we've been talking about phenols as we've been talking about pharmacognosy in some of our later episodes. Chen add carbohydrates, lipids, and essential oil to the contents of this. So the science, according to Chen and Chen, the pharmacological effects of chán tui include being a central nervous system suppressant. So there you go. That's an interesting one. A review also discusses chán tui's anticonvulsive and hypothermic effects, so lowering of temperature effects. They also discuss a few positive clinical studies. One discussed the use of chán tui for treating tetanus in 8 patients. Another looked at 30 chronic urticaria patients given a formula of 2 parts chán tui to 1 part Bai-Ji Li or fructus tribuli and honey. Finally, a third study used chán tui powder topically to treat rectal prolapse in 15 patients. So none of these are statistically valid. So yeah, so there you go. A Google Scholar search showed several animal studies, but no clinical reviews about chán tui's effects. So nothing really useful there at all. Drug-herb interactions. Chen say chán tui may have an inhibitory effect on the central nervous system, potentiating sedative drugs, including barbiturates, and reducing the stimulant effect of caffeine, based on a Chinese language article cited with indeterminate evidence level. So in other words, this I think is going to be mostly I think opinion. I don't know if I've ever seen any inhibitory, any sedative effects to this, but supposedly it does have some. A literature search did not find further interactions between chán tui and various cytochrome P450 isozymes or P glycoprotein or other transporter proteins, so nothing there for drug-herb interactions. One of my go-tos for interactions and safety is the American Herbal Products Association's Botanical Safety Handbook, which has a ton of Chinese herbs in it, as well as Western herbs. It's a fantastic book. And it does not, unfortunately, have an entry on this quote unquote herb. And that's probably part of the reason. I don't know if I don't know if I've ever seen an animal substance in this particular book. So there you go. Concerns. What are some concerns about this medicinal substance? So Bensky et al. Notes several concerns with chán tui. Under the heading of cautions and contraindications, they say, quote, many pre-modern materia medica texts record the use of this substance for delayed labor and to promote the expulsion of the residue of the birth process. It should therefore be used with caution in patients who might be pregnant, especially if they have a history of miscarriage. Under the heading of toxicity, they say there have been a few reported cases, preparations of this substance leading to abdominal pain. Symptoms appeared 15 minutes after ingestion and disappeared 15 minutes later. Allergic reactions have also been reported, including generalized pruritus or itching, erythema or redness, facial flushing, sweating, fever, hoarseness, and palpitations. Chen and Chen have some concerns as well. And they, quote, say, chán tui should be used with caution in pregnant women as it may impair labor and cause difficulty in delivery. Chronic or repetitive use of chán tui may consume qi and yin. Therefore, use with caution in patients with these deficiencies. Use of chán tui may be associated with possible drowsiness and sedation. Therefore, individuals who take this herb should exercise caution in driving or operating heavy machinery. Again, Chen are making this case about sedation. We don't really, we don't see that under Bensky. They don't mention that at all under Bensky. So it's an interesting, if you're not familiar with Chen, their brother and sister, they run one of the larger Chinese herbal companies here in the United States. And John Chen is a pharmacist, so he has a pharmacology background. So he gets into the science of these things. So if he says something, then we certainly need to take it with some authority. I just would like some more specific evidence of the sedation aspect of this herb personally. Continuing with concerns, Brandon Wiseman warns use with care in pregnancy. So that's all 3 books are saying be careful with using this during pregnancy. And it seems like that's definitely warranted by, I would say, ancient empirical evidence. So, and as I mentioned earlier, the American Herbal Products Association's Botanical Safety Handbook does not have an entry on this herb. I usually will bring up any concerns that has here. And what I love about this particular handbook is it actually has ratings. It has a drug herb interaction rating and it has a safety rating. So it's very easy to see if a drug may be likely to have drug herb interactions or likely to have some important warnings. So I like having the herbs mentioned in that book, but this is not. Okay, we're wrapping things up. So today we started with our discussion of the 5 elements of acupuncture medical ethics. Then we looked at another single Chinese herb, quote unquote herb, chán tui, Cicada Periostracum, or Cicada Molting. This herb is in the Chinese medical subcategory of cool acrid herbs that release the exterior under the category of release the exterior herbs. It is helpful for certain types of colds and especially for expressing rashes, clearing the eyes, and stopping spasms, convulsions, and tetany. With that, we conclude another exploration of a very useful Chinese, quote unquote, herb, Chinese substance, medicinal substance. In 2 weeks, we will be looking at another herb of the world, the Ayurvedic herb Vasaka, or Justicia adhatoda, or Malabar nut. It is considered a very important Indian herb for supporting the lungs and respiratory system. We will be doing our deep dive into this herb and how it affects the body in Ayurvedic terms, as well as Chinese and Western perspectives. And as usual, we will look at something a little different. Please join us as we don our pith helmets, equip our machetes, and enter the jungle of medicinal herbs in our next exciting episode. And I'd like to say thank you very much for listening today. If you like this podcast, please think about doing us a huge favor. Subscribe in your favorite podcast app. We appreciate it. And we thank you for even considering doing that. And you can get this course as well as many others as continuing education units and National Certification Commission of Acupuncture and Oriental Medicine professional development activities at www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org. And don't forget that 20% off with the code SH20OFF or the course 5 Elements of Acupuncture Medical Ethics. You can always get in touch with me at Dr. Greg at spurbsherbs.com or at our website, www.spurbsherbs.com. And we thank you very much. I don't often explain this, but if you're looking at this, I have an herb picture color code, and I've kind of color coded the pictures so you can see what the flavors are, the temperatures, and where they enter. It makes for some interesting pictures, let me tell you. And as usual, we have quite the bibliography. And here we go. Again, thank you very much for joining us today. The proceeding was presented by Dr. Greg Sperber. We would like to thank Janelle for all her support and everybody else who contributed to this program.
Timothy Dobbins, Roger Campbell,